Hi, my name's Cindy Farr, and I'm the Incident Commander for the Missoula County Health Department's COVID-19 response. Today is Friday, July 17th, and this is my daily briefing. First, I just want to say happy Friday to everybody, and I hope you have a lovely weekend. To date, we've had 157 cumulative positive cases in Missoula County. That's up 6 since yesterday. 154 of those cases were identified by testing, and 3 were epi-linked. We've had 108 recoveries and 1 death. 2 Missoula County residents are currently hospitalized, and we have 48 active COVID-19 cases with over 320 close contacts. Active cases and their contacts are in quarantine and isolation, and they'll continue to be monitored and supported as needed. The state of Montana is reporting 2,366 cumulative COVID cases, which is up 137 cases since yesterday. There are now 1,337 active cases with 45 active hospitalizations across the state. That's 8 more hospitalizations since yesterday. And there have been 37 deaths related to COVID-19 in Montana. That's up 2 since yesterday. So we continue seeing active cases rising in Missoula County, across the state, and across the United States. Closer to home, we're seeing just how incredibly quickly COVID can spread, especially in single environments like workplaces and homes. We're also seeing how devastating COVID can be to individual and their community. Not everyone is equally impacted by COVID. While some people present with mild symptoms, others need acute, immediate, and sometimes ongoing emergency care, as indicated by the active number of hospitalizations and deaths related to COVID-19 that we have at this time. Remember that this is not just an old person's problem, quote unquote. Unfortunately, that's how COVID first presented itself, as well as how it was first messaged and talked about. We've had plenty of time between now and then, and we now know more about the novel coronavirus today than we did 4 or 5 months ago. We know that anyone can be impacted by COVID, anyone can get it, anyone can spread it. We know that those people with pre-existing medical conditions are more likely to contract COVID and are more likely to experience more serious symptoms and long-term health outcomes. We've seen that young children can get COVID, teenagers, college-age students, as well as grandparents and older adults. COVID does not discriminate and it does not stop, but we can continue to be prepared to keep it at bay in our community. One of the ways that we can keep it at bay is by adhering to state and local orders and directives, including complying with the face covering rule. The face covering, in addition to all those other safety behaviors, is a great tool for slowing the spread of COVID-19 by reducing the chances of asymptomatic or pre-symptomatic spread. So remember, we talked about this a while back. Asymptomatic refers to people who are more likely carriers. They have the virus and they can transmit it, but they never actually have symptoms themselves. Pre-symptomatic spread refers to the time period before a positive test before symptoms occur. So basically for a couple of days before you actually start developing symptoms. Both asymptomatic and pre-symptomatic individuals could unknowingly expose and transmit COVID-19 to others. Wearing cloth face coverings helps to reduce those exposures and keeps that transmission in check. I'd like to revisit and remind people about the discrepancy in our state and local reporting. We fully expect to continue seeing discrepancies across our sites, even with our partners, because of the nature of COVID and the differences in processes and timelines for opening a case, investigating a case, and closing a case. Missoula County numbers continue being the most accurate reflection of COVID-19 in our county, and we encourage you to look at our numbers for the most current information. We have had hundreds of staff working on COVID response at both the local and state levels, and some of these people are taking well-deserved respite, which is time off from the response effort to ensure that, in general, we can continue responding in a sustainable way and don't start to experience burnout. In addition to different processes and timelines for opening, investigating, tracing, and closing cases, we also have another factor at play, which is people needing, deserving, and taking time off at a time when public health has few additional personnel resources to pull from. All this is to say that we know that the discrepancies are there and they will continue to be there. We appreciate the need to see accurate and timely information, and we continue providing the public and media with the most accurate and up-to-date information that we have available at the time. Next, I'd like to plant the seed for a special environmental health business briefing that we hope to have midweek next week. Earlier this week, I mentioned that we were working on some face covering FAQs as well as some business guidance for employers that have been wondering about what to expect when there's a positive case of COVID associated with their establishment or their business. We were a little delayed in getting that information finalized and needed to revisit the documents after the governor's press conference and subsequent face covering mandate. These documents are now finalized and they're up on our county website. Our call center and environmental health staff have this information too, and they're ready to field questions related to these documents. I won't get into too much detail about either document right now, as we will discuss them in further detail next week. In general, the FAQs remind us that the local face covering rule is in addition to all local phase 2 guidance, including expectations for large events and gatherings. Locally, people ages 5 and older need to wear face coverings when inside specific public settings, as well as in specific outdoor settings as indicated by the governor's directives. Face shields are not a replacement for a face covering. Face coverings are required in Missoula County. Our face covering rule is not dependent upon the number of active cases in our county. Our face covering rule is effective until further notice. Our local rule does not allow for any kind of artist, speaker, performer exemption. Our local rule requires that people wear face coverings inside settings that might not be open to the public that do not allow for 6 feet of space between staff, employees, or personnel. The business guidance outlines what an employer could expect if and when there's an active case associated with their business or their establishment. It covers topics like what patient notification looks like, what case investigation and contact tracing looks like, what cleaning and sanitizing looks like if and when there's an active case. It also outlines what is personal and private information and what can be shared or not shared regarding an individual's private health information, as well as instances of when it might be appropriate to share case information, such as if it would otherwise be very difficult to notify all potential close contacts. Think like a restaurant where people are coming and going, or an event where people are coming and going. I hope you're all able to enjoy the next few days and that you get what you need, whether it be rest, reflection, or a rowdy fun time with safety measures in place, including face covering, hand washing, cleaning, and safe social distancing. Remember that the face covering is not a replacement for other safe behaviors. It's a complement to those other safe behaviors. So that's it for my daily briefing today. As always, you can subscribe to me on YouTube under my name, Cindy Farr. That's CindyFarr. Click that notification bell so you get notified when additional videos are uploaded. You can follow us on Facebook at the Missoula City County Health Department's Facebook page. You can check out our website and you can find that guidance that we just discussed on our website at missoula.co/cvirus. And you can call 258-INFO if you have questions about COVID-19 or would like to schedule a test. So with that, everybody be healthy, and I will talk to you again on Monday.